Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I want to welcome all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions in the GoToWebinar chat box. MS navigators are online throughout today's program, answering questions and connecting you with resources. Magnetic resonance imaging, or MRI, has made it possible for neurologists to visualize and understand much more about MS and the underlying pathology of the disease. Currently, MRI scans are the preferred tool to establish an MS diagnosis and to monitor the course of the disease. Today, Dr. Scott Newsome, an associate professor of neurology and the co-director of the Multiple Sclerosis Experimental Therapeutics Program at Johns Hopkins Medicine, is joining me to share the updated international MRI recommendations for people living with MS. Welcome, Dr. Newsome, and thanks for being with us today.
Thank you for the invite.
Before we dive into the new MRI recommendations, let's start with a little MRI 101. Can you tell us what an MRI scan is and how this technology actually works?
Sure. I know for the audience, many of them have had an MRI and probably think it's a torture chamber, right? But it's actually more than that. You know, it's an imaging technique that helps produce images of organs and tissues, and how it captures and acquires these images is actually fairly sophisticated. It uses magnetic fields and radio waves to sort of acquire images that are of interest, for our purposes, looking at the brain, the spinal cord, the optic nerves. The one thing I like to point out to people is it's not radiation. So this becomes very important because when we talk to our patients about doing an MRI, whether it's yearly for a period of time or every other year, people get concerned that, oh, geez, is this like a CAT scan? And, if there's radiation involved, this is, a potential risk for cancer, but this is not. And so that's the good news, and that's why we feel it's important to do, and we'll get into this, I'm sure. But a really, really awesome technology that can help not only diagnose, but monitor people with MS and related conditions.
And why are MRI scans so important in diagnosing and monitoring people living with MS?
Yeah, so I'll tackle the first part in terms of diagnosis. When someone comes with a neurological symptom, whether it's numbness, tingling, vision loss, that can be from a variety of things, including vitamin deficiencies, right? And so numbness and tingling is not just specific to MS. The MRI really helps aid in the clinical suspicion for a diagnosis of MS. And it can also help rule things out, and also detect like, oh, well, is this a mimicker of MS, whether it's a condition like neuromyelitis optica, for example. In terms of monitoring, especially after someone has started a medication for their MS, it can give us an idea of how well is that medication working for the individual. Are we not only preventing relapses, but are we also preventing new spots from forming over time, which is the goal of the disease-modifying therapies that we have. Moreover, I'd say just as important is for safety. Some of our medications come with some, side effects, including infections, and occasionally we can pick those up on MRI even before they become a problem. So very important to get MRIs for also safety-related issues.
Well, one of our viewers, Marcus, wrote us saying that he's had MRIs of his brain and spinal cord. And Marcus wants to know how his doctor decides where they scan during the MRI. And he's wondering whether his specific MS symptoms are any sort of a factor in making that determination.
Yeah, that's a great question, because I think sometimes on our side, we don't explain it to our patients of why we're imaging this particular body region. So, when we see people up front where we're concerned that they have MS, based on international consensus, we feel that doing a brain MRI and cervical spine MRI are sort of the go-to regions of the body to image. And that's really to, number one, look to see, okay, do we feel confident this person has MS? And number two, what we determine the lesion load that the person may have or experience. And so imaging those particular regions of the body are important. Now, Marcus' question about, his symptoms. So yes, that does come into play. And an example would be if someone, let's say, has leg weakness and bladder issues. If you do just a brain MRI, you may not capture the area that's involved. And so the spine gets involved in MS, more so the cervical spine and thoracic spine. But if you don't image those regions based on the symptoms that someone's coming in, you may miss it. And that could actually prolong the diagnosis, like preventing someone from getting diagnosed early, or maybe someone is on a treatment and you want to switch a therapy, but you miss the opportunity to potentially switch because you don't find a quote unquote new lesion because you didn't image that region of the body.
See. And how often should someone who's living with MS get an MRI?
Yeah, so we usually will recommend, and what I'm going to say, part of this is from the recent international consensus guidances, is when someone initially gets diagnosed with relapsing or remitting multiple sclerosis specifically, after they start treatment, we'll usually recommend doing a brain MRI and maybe a cervical spine MRI, depending on the scenario, 3 to 6 months out from starting that therapy. That could be very similar if, let's say, they had what we call subtherapeutic response to the treatment. So the medication is not working for the individual. We will also, at the time of switch, do a baseline MRI and then another MRI 3 to 6 months out from that new start. And then, if someone is doing very well on the medication, the MRI, let's say at that 6-month time period looks good, exam is doing well, then most often people will say, well, let's do an MRI a year out from when you started the medication, or a year out from when that new reference baseline MRI was captured, which is that 6 months after starting treatment. So there's some variability there. And then let's say down the road, the person's doing really well, and we're not concerned even from a safety perspective. There are some people that we will do an MRI every other year. And I'll say though, John, this is an important point, that these time frames that we put in perspective, they're not written in stone. If someone has something that comes up that worries us, like they have a new symptom in an area that we feel, well, maybe this is a new attack, a new relapse, or a safety concern, we will do an MRI sooner than that sort of previously scheduled time frame.
I'm wondering, does that recommendation of 1 year or every other year, does that change as someone ages?
Great question. So it does, and I'll say that where it primarily changes is thinking about the disease activity. How long has someone had MS? And if it's someone that's had MS for a very long time, and again, if they're stable on their current therapy, or maybe they're not on a therapy and they are seemingly stable, then we can extend out the interval between MRIs. And I would say I have some people now in their 60s and in their 70s who may not be on a disease modifying therapy, or maybe they're on one that we don't have really major safety concerns like this brain infection called PML, what's been associated with some of our medications. Maybe they're not on a medication that's been associated with PML. There are some people where I'll say, you know what, maybe we don't need to do an MRI unless something comes up new clinically. But the younger the person, the earlier they are in the journey of their MS, we're usually a little bit heavy-handed on the MRIs up front. And then if we're switching, medications, we will also, be a little bit heavy in terms of how often we do the MRI.
Well, as we both mentioned, there was an international consensus of updated MRI recommendations, which provided guidance on how and when to use MRI for diagnosis, prognosis, and monitoring disease treatments for people living with MS. Dr. Newsome, who was involved in developing these recommendations and why are they important now?
Yeah, it has been an incredible, lengthy time since the start of developing these protocols and consensus guidances, and a lot of people have been involved actually. And I don't want to say 100, but maybe it's 100 people. But there's three major organization and groups that have came together. So CMSC, NAMES, and Magnums. It's really an international committee of researchers, clinicians, neuroradiologists, and it really spans over decades. And what was really cool about this, because I happen to be involved, which I'm really honored and grateful to be involved in this, is just seeing how things have developed over time from the initial sort of protocols that were being recommended from, let's say, the core sequences, to how often should you follow patients over time with MS, to special populations of interest, children, people who are pregnant, what do you do with imaging? And so a lot of people were involved in developing these guidances. And, I suspect that as novel imaging techniques come out, as we start to see, what's happening even deeper at the microscopic level with imaging, there will continue to be, these groups getting together to figure out what can we, pass on to our clinicians and radiologists in terms of, when should you do MRIs and what sequences should be done. And so it's really been exciting to see these come to fruition. And, we need this global effort because these need to be adopted for our patients.
Well, let's take a closer look at some of these updated MRI recommendations. Brain and spinal cord MRI protocol is standardized when someone's in the process of being diagnosed with MS. What does this new protocol include?
Yeah, so in terms of, there's a lot of different ways you can refer to these, and I would look at it from a couple sort of 50,000 foot view points. So one is we want to say, okay, well, what parts of the body do we want to image, right? And as you discussed, brain and spine, there's also the optic nerve that sometimes we'll do if someone has optic neuritis. So first it's, thinking about which part of the neural axis you want to image. Up front, brain, definitely, sometimes spine. Then you want to look at, what is the strength of the magnet? That's becoming more important in terms of identifying small lesions that maybe are not seen on lower power magnet strength images. And so 1.5 or greater is what's being recommended, and 3T scanner if you can get it. And then looking at core sequences, and we don't have time to go into this, but there's a number of core sequences that are being recommended that at bare minimum for our patients, this is the standard of care that need to be done to acquire the information we need, not just for diagnosis, but also for monitoring people over time. And then looking at another thing that people may not be familiar with is slice thickness. Like back in the day, we were taking these images and acquiring them like with these huge gaps in slice thickness in between different regions of the brain and spinal cord. And there you were missing a lot of the action. And so now no gap, slice thickness very small so we can see more. And that will actually help us make treatment decisions up front and over time for our patients. And then another piece of sort of, I think, these guidances is when do you use contrast, which there's been a lot of interest and a lot of debate around, contrast agents and is it safe, is it not safe? And if it is safe, well, do you have to do it on every scan? And so the protocols that are being put forward from this group are highlighting a lot of these, I think, very important topics and points.
Well, I want to circle back to the issue of contrast in just a moment, but since you raised the issue or pointed out that the strength of the magnet is a consideration, Keem is asking if he should talk with his doctor or the imaging center about the type of MRI machine they use.
Yeah, so this is really critical, and I think some of this is out of our hands based on insurance. Insurance carriers will say, hey, sorry, you can't go to the better quality MRI scan this time around. You have to go to the subpar one. But I will say, yes, if you're a patient or a loved one and you feel that, maybe the MRI quality from this center is not up to standard of care for what we as MS specialists want our patients to get, then absolutely ask questions. I would ask your clinician what type of MRI. Is it the standard of care that MS specialists would want? And so, we will ask people, yes, do it. Now, there will be some places around the world that don't have access to the, greatest and best imaging quality. But there are a couple rules. One of the main rules is if you're going to a specific facility and that's where you have to go, then trying to stay at that facility for the duration, because we don't want to be comparing apples to oranges with the imaging quality. And as I mentioned, the 3T versus 1.5T, we prefer 3T, but there are some instances where 1.5T is your only option. But again, consistency, making sure that you're in the same scanner as best as possible. And then if you're switching, let's say from one doctor to another, or from one radiology facility to another, what the guidelines or the guidances will recommend is maybe updating your MRI to that higher quality MRI and doing that even if it's close to the lesser quality MRI, so you have for future reference, a reference MRI that you can look at and compare. And so now you're comparing more apples to apples. But I would definitely encourage, the patients who are listening to inquire about the MRIs because it is the most sensitive tool we have in helping diagnose and then also monitor people over time.
How do doctors standardize how they interpret an MRI image? In other words, could different doctors see things differently, arrive at different conclusions, and perhaps even provide a different diagnosis to the same person if they're all looking at the same MRI?
How much time do we have, John? I don't think we have time to go into all that. I will say yes, that what is it, the eye of the beholder, right? And so there's definitely differences of opinion. I will say the McDonald criteria that we use to help make a diagnosis helps sort out some of this. There are specific areas within the nervous system that like to get involved with MS. And so when we see those cardinal areas involved, it makes us feel more reassured that, okay, this could be a lesion related to MS. So that helps, I think, streamline things a bit. There are people that have extra expertise in reading MRIs as it relates to neurological conditions called neuroradiologists. And so sometimes having a neuroradiologist review an MRI is quite helpful because they're looking at things a little bit differently. And I would say I say this to our residents and fellows, looking at MRIs is like reading EKGs. You have to look at them yourself. You have to do it over and over again to be able to feel comfortable looking and feeling like you know this is a lesion related to MS or not. But there is a lot of variability in the interpretation. And I would say sometimes even the experts don't know if this lesion is MS or not, especially if someone gets older. As they get older and they have like high blood pressure, diabetes, white matter lesions can happen in that context. And so repeating MRIs over time, following people closely in the clinic, sometimes is helpful in elucidating, whether that lesion is MS or not.
You mentioned contrast a moment ago, and I promised we'd circle back to it. So I'm hoping you can tell us what gadolinium is, how it works, and what it shows in an MRI scan of someone who's living with MS.
Sure, yeah. So gadolinium, it's part of the contrast agents that are used. For those that may not have ever had an MRI and had contrast agents, this is administered through the IV. And what its goal is to really help delineate different regions of the body that are being looked at. So, contrast, since it's going into the blood vessel, you can see blood vessels light up when we look at the MRIs, and that's helpful in looking at the tissues around. As it relates to MS, it can help tell us, is the MS angry? Are we seeing lesions, contrast enhancing, which tells us that there's active inflammation going on, which is not a good thing in MS. And that is not a good thing at any time throughout the journey of someone's MS. It can also look at non-MS related pathology. There are some tumors that will contrast enhance. There are, other tissue organs that will pick up enhancement that tells us, oh, there's actually other parts of the body that are inflamed, which we don't see in MS. And so it could be a mimicker of MS. And so that's sort of the quick and dirty of it. But it is helpful early on in making the diagnosis, and then also after someone starts a medication and seeing how well a medication suppresses that active inflammation. But as I think I alluded to, not all people need the contrast scans every single MRI that's acquired. And that was one of the nice things I think about the consensus group coming together, because there's been some question about the safety of some contrast agents. And there's still some unknown, but we can all agree that early up front, we want to get contrast, especially for diagnosis, and then shortly after starting medication.
Well, you've shared some really great information with us today about these new international MRI recommendations. What would you say are the top 3 takeaways that you'd like our audience to remember?
Yeah, well, these are always tough questions. So I'd say get an MRI, because there are still people out in the community, neurologists included, that after someone's been diagnosed and in that short time frame, they recommend to their patients, no, we don't need to get an MRI. So, we ask you to advocate for yourself for getting an MRI, especially even if it's down the road, if you are having new problems. And it could be related to MS, or as equally important, maybe it's a safety related issue from the medication that you're taking. Number two is asking the questions about what type of MRI, the quality of the MRI, the Tesla strength. Are you getting in the tube that is the up-to-date standard of care, sequences and Tesla strength that an MS specialist would want? And then number three, let's see, I have so many, they're all floating in my mind. I would ask about the contrast, because maybe you're in a particular part of your journey with MS that you no longer need contrast. And so I think that would be important to ask your clinician about.
Well, I want to thank those of you who submitted your questions today, and thank you, Dr. Newsome, for being with us.
Thank you.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. And for information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways to get involved, and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start right here. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Newsome for joining us today. Please remember that a recording of this webinar is going to be available at the Society's website at nationalmssociety.org/MSexpert. It'll also be on Facebook, and you'll find it on YouTube as well. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us to continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Scott Newsome and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.